Hello, my name is Elder Martinez and I will be presenting stress and pregnancy. Prenatal and perinatal stress. Perinatal stress is at or around birth, while prenatal is the time before birth. A growing body of research demonstrates that stress before and during pregnancy is associated with poor birth outcomes and subsequent poor health outcomes for children, meaning that not only are they birthed premature, which is before 37 weeks, but they're also not in good health. However, mothers are also in danger of suffering from negative effects. Reasons for stress. Stress for a soon-to-be mother could be caused by moving to a new home, financial problems, marital or partner problems, unplanned pregnancy, past experiences with miscarriages, which seems like a tough topic to talk about, but it happens, being a single parent, the death of a loved one, or just other things that could also be involved. Different stressors. Acute stressors early in pregnancy have been associated with increased risk for preterm birth. For example, one study found women in their first trimester who lived near the World Trade Center on 9/11 had shorter pregnancies on average, which means that they experienced so much stress from what happened that day, which makes sense, that they all had preterm births. Chronic stress can cause complications such as preterm birth, low birth weight, hypertension, and developmental delays in babies. Post-traumatic stress disorder coupled with a major depressive disorder has been associated with 4 times the risk for preterm birth, independent of the effect of prescription drugs. So post-traumatic stress disorder can deal with any past trauma, such as maybe the incident of rape or abusive relationships. So this obviously can cause a lot more stress to the mother that's having to deal with all of it. So of course, the child in turn is gonna have a preterm birth due to all the stress. Effects of maternal stress on the child. Stress during pregnancy has been associated with low birth weight, preterm births, and infant mortality. These may have long-term effects on for the health and development of the child. Women who experience high levels of stress during pregnancy have 25 to 60% higher risk for preterm delivery, even after accounting for the effects of other established risk factors compared to women with low levels of stress. In the case of stress during pregnancy, low birth weight is not always coexisting. Babies can be born with low birth weight even if they are not preterm births. Stress results in increase in cortisol, norepinephrine, and inflammation, which affect the fetal environment and have implications for maternal and infant health. Women who suffered from maternal stress are 40% more likely to deal with babies who develop sleeping problems. Long-term effects on the child. Stress could increase the risk for developmental delay and low birth weight babies. Mothers stressing over the loss of a loved one have been associated with obesity and overweight in their children. High levels of stress during pregnancy increases the likelihood of having a child with autism-like characteristics. So autism-like, not actually autistic. They are more likely to develop bad health problems as adults, such as high blood pressure, heart disease, and diabetes. Preterm babies are vulnerable to lung disease, developmental delays, learning disorders, and infant mortality later in life. Human studies are showing that stressful prenatal events such as intimate partner abuse, poverty, and food insecurity have enduring effects on the stress physiology of offspring and that prenatal and early childhood stress can set the stage for lasting psychological and health challenges. Effects of stress on mother. Between 8% and 13% of women are diagnosed with anxiety or depressive disorders during pregnancy, and many more already have such a diagnosis when they become pregnant. As many as 8% of women have PTSD during pregnancy. Women who have PTSD may be more likely than women without it to have a premature or low birth weight baby. Stress is a silent disease, says Dr. Hobel, Director of Maternal Fetal Medicine at Cedars-Sinai. Pregnant women need to be educated in recognizing when they have stress, the consequences, and some of the simple things they can do to make a difference. Mothers can suffer from perinatal depression due to high levels of stress. This could lead to poor interaction between the mother and the baby after the birth. High levels of stress that are constant through a long period of time could cause high blood pressure or heart disease. This is, of course, on the mother as well. Recommended practices for stress relief. You could attend yoga or meditation classes to help relax the body and the mind. You could talk to someone about your worries, such as a family member or a partner. You could also exercise and eat healthy foods. And you could find help in your community, such as organizations or other groups that help pregnant women. Effects on different age groups. Babies that experience prenatal and perinatal stress are affected as infants, which are 0 to 1 years old. Maternal stress can cause low birth weight, infant mortality, and preterm births. As adolescents, which age 10 to 19, one study found that increased fetal cortisol levels may affect the function of a certain part of the brain, which leads to impaired cognitive reaction time in adolescents. And adults 20 to 60 years old, babies who experience stress in the womb are more open to develop chronic health problems as adults, such as high blood pressure, heart disease, and diabetes, as mentioned before. The March of Dimes supports research programs and policies which address risk factors to prevent stress-related pregnancy complications. This organization provides families with education on pregnancy, baby health, and motherhood. They also support research for birth defects such as premature births. And it was founded by Franklin D. Roosevelt.